you're a beginner and you don't know where to start with your weight loss program, what is the best fitness regime that you can follow to get your body back?
Hey Roshini, so I've heard about your pregnancy. Of course, your delivery happened a long time before we met, and but I heard that you lost about close to 30 kgs post delivery, and you did deliver triplets. And I have heard that your pregnancy was not an easy one. And you know, we frequently get a lot of people who we work with who want to know how you did this, how was the pregnancy, how did you lose all that weight? So why don't you tell me a little bit more about it, and you know, let me see how much more I can find out about that time in your life.
Yeah. Okay, so what happened was definitely crazy. I came to know that I was carrying triplets, and it was definitely a challenging pregnancy. I was in bed like for almost 8 months. I was in a complete bed rest. And then post the pregnancy, definitely because of the bed rest, I faced a lot of health challenges, you know, back aches and knee aches, joint aches. And then what followed was just the absolute weight gain. And you know, people telling you need to eat this, you have to feed 3, and just kept eating. And then my weight just went on until I touched 90 kgs. From about 58, I was like 90, and I was falling sick, and I was actually, you know, completely depressed. I used to be a chartered accountant at that time, and I knew nothing about workouts. Went to the gym, did some wrong stuff, did some wrong workouts, again ended up with a disc bulge, couldn't do anything further. And then one day, I used to be an athlete before, I was completely out of my you know, fitness, and that really made me upset. And I decided to fight back. I wanted to learn how to work out, for which I started learning, reading. I certified, my passion into fitness grew, and I gave the exams, and I started learning further, did certain other certifications, and then finally learned here this is the right way to, you know, lose weight post-pregnancy. Like we start off with a lot of myths regarding how do you get your body back after pregnancy, and everybody is just running to the gym, or you know, somebody is just beginning some random workouts which may not be the right ones for you at that time, right?
And in fact, a lot of people don't begin to work out because they believe that now is the time for you to rest, and the body has undergone a great trauma. You know, delivering a baby is considered to be a trauma.
It's more like a disease.
It's
considered like
the way people, the way it's talked about and the way it's approached. Whereas I guess it's the most natural thing for a woman's body. A woman's body is designed to deliver babies, you know, and we're designed to procreate. It's not like a man has had a baby and he suffered trauma, and you know, and he needs to rest and recuperate and recover. So so that's I guess you were also facing a lot of that. So how did you get out of that? What was that point when you said that okay, all of this is not right?
Exactly. So what happened was, when I started learning, I realized that a lot of things I was doing was wrong. And what my first realization was that I am actually too late to start this. If you're someone who's had a normal delivery, you should ideally start your workouts within 3 to 4 days of your, you know, post-delivery. Even if you're someone whose delivery was a C-section, you should still start workouts within 3 to 4 days of your delivery.
Right.
And the idea is to learn which are these exercises that you should do within 3 to 4 days of your delivery, right? So generally people say that, you know, if it's a normal delivery, 2 months, please don't do anything. If it's a C-section, for about 6 to 12 weeks, please don't do anything. But I think that's wrong. Someone who can begin a workout routine post-pregnancy as soon as the delivery, right, can get back in shape like much better, faster, with a better body than someone who's going to start it like 3, 4, 5, 6 months, or you know, a year later. So the general trend I have is like the people I work with, they come to me when the baby is about 15 months, 16 months. You know, it's just so general. Like they come, now my baby is a little older, I can work out. I'm like, okay, I will help you, but you're a little late.
Right? No, in fact, I get a lot
I'm not meaning it like that, but that's not the time. You should have done it a little earlier. So which is why I want to communicate this message out to women that see, you need to work out during, during and post your pregnancy, and it has to be a continuation through all these stages. There is no break.
So what would you say some of the workout or exercises are for during the pregnancy?
During the pregnancy.
Yeah.
During the pregnancy, you can do anything that you've been doing. Say in the first trimester, it's split, right? First trimester, second trimester, third trimester, you can do these. Of course, there is modifications in all of these. But like within the first trimester, you can actually continue. Say if you're someone who has already been doing particular type of workouts, you can actually continue that through your pregnancy.
Right.
But by reducing the intensity and avoiding certain movements, which is contraindicated for
and how, what's the best way for a woman who is pregnant, and she wants to work out, or she has been working out, but she's growing up in an environment where people are telling her not to work out. So what is the best way for her to find out what is right during the pregnancy and what is not?
So workouts remain the same, whether it is pre, post, during, whatever it may be. It's that you need to have do your stretches, cardio and strength routine, right? So depending upon your which trimester you're in and avoiding certain movements, you can do any of these. There is a general rule, I don't know, maybe it's a myth that you should not ideally raise your heart rate above 140 beats per minute. I kind of little disagree with that, because 140 beats per minute may not be the same for every individual.
Right.
So what you need to follow is, are you over-exhausted? If you're over-exhausted, then there is a chance that there is less oxygen supplied to the uterus, right? So the baby is deprived of oxygen. But the most ideal thing for you to do, like what intensity can I work out at, is an intensity where you do a talk test.
Okay.
A talk test basically means that you can talk comfortably at the time when you're doing a workout.
Right,
if you cannot say something really comfortably, you cannot sing a national anthem properly without like breaking it. It just means you're doing something too much. So a talk test, I would say, is the ideal thing for you to understand. If you can comfortably kind of talk during your workouts, it is quite a good intensity that you're following.
Like how is that?
Hi, I'm Dr. Rashmi Shetty, and today we'll speak about different kind of cleansers and face washes for different type of skin.